Okay, good afternoon, everybody. My name is David Weisberg. I'm the CEO of the Federation for Jewish Philanthropy of Upper Fairfield County. And I want to welcome you to today's installment of a continuing series of webinars that we've started offering the community in this, this new environment that we're all living in together now. Some of those have been informational, educational. Some of them have been opportunities to smile and share a little bit of joy and music together. I'm really grateful for the one that we're having today because it's an opportunity for me to have a conversation with two of my important colleagues that I haven't gotten to check in with as much as I would like to, and to do that in a very public way so that you have an opportunity to not only hear that conversation, but participate in that conversation as well. Clearly, the COVID-19 crisis has had repercussions throughout our community, and not the least of which on our primary Jewish social service agencies, Jewish Senior Services, and Elaine and James Schoke Jewish Family Service of Fairfield County. And so I'm pleased to be joined this afternoon by Andrew Banoff of Jewish Senior Services and Matt Greenberg of Schoke Jewish Family Service. The way that this hour or so will work is that I look forward to having a conversation with Andrew and Matt for probably 20 or 30 minutes, and then we want to give you the opportunity to join into that conversation as well by asking questions. I want to let you know right now that when it comes time to ask questions, that there are two different ways that you can do that. One is through the chat feature. The other is by going in and doing the virtual raising of your hand. If you do the raise hand function, I want to let you know that I'm going to try to bring you into the conversation as a live panelist. So in the least, your audio will become part of the public conversation, but there's a chance that if your video is on, your video will become part of the public conversation as well. And so I want to give that forewarning to anyone who might be sitting in their pajamas watching this webinar, not realizing that all of a sudden they're going to be on video in front of the whole community. Andrew and Matt, thank you so much for doing this. I can't imagine the ways that your lives have changed over the past, it looks like we have someone who is also on, okay, here we go. I can't imagine the ways that your lives have changed over the past couple of weeks. And before we get into what's going on at your organizations, I just want to ask, how are you doing?
Well, David, thank you for orchestrating today and for all that you're doing in the community to keep us connected. I think that's an enormous challenge, and in light of the circumstances, something that everyone is clearly craving. So very much appreciated. And I think the short answer to the question of how we're doing is we're okay. We're holding our own in terms of trying to keep pace with all of the changes, which feel like they're happening more and more every day. And the good news, perhaps the challenging news, is that we're working with an incredible group of people that are dedicated to doing the right things and finding our way how to address and how to solve those problems. So in general, good, but with lots of challenges in front of us to contemplate.
So Andrew, I want to be more specific because we'll talk about everything that's going on at JSS. I want to know how you're doing.
Me personally, I can say stressed in ways that I didn't think were possible, but again, surrounded by a lot of great people, both personally and professionally, that make it all doable. But it's a lot. This is unprecedented, certainly in my career, and learning things that I did not plan on learning, and certainly dealing with agencies in ways that we've not dealt with before. So it's a lot to process. Right.
Matt, how about you? How are you doing?
Yeah, I would agree with Andrew. The stress level is very, very high, but I think one of the things that's been really neat for me is the way in which the community has come together, which is just fascinating. We have a WhatsApp group that was formed that has 150 people on it, all of whom are just looking for ways to connect and ways to do things for people and with people. You know, the different people that are actually willing to help other people that have come out through this disaster are just very, very heartening. So no question that the stress level is high. I've also, as Andrew, had to work and deal with organizations that I've never reached out to before. But I'm really pleased to say that people have really come through. And it's really nice to see how caring our large community is. So that's been great.
Great, thank you. So I want to get to talking about what things your organizations can do for those in the community who are in need now, and ways that those in the community who want to help can help with what you're doing now. First, I'm just interested about how what's going on now affects the status quo, the things that you've been doing every day. Matt, what's the ability of Schoke JFS to carry on those things that were already on your plate, or are there things you've had to stop doing, adjust doing?
Yeah, well, one of the things that we've seen is we do a lot with food insecurity with our food pantry and our kosher home delivered meal programs, and the capacity at the moment is keeping even, but we expect that really to explode. We are getting in the neighborhood of somewhere between 10 and 20 new calls each and every day for people who are out of work, who need food, who can't get to the supermarkets and can't purchase their own food, and then trying to orchestrate how they actually are going to get it from us has become, very challenging. So we're not allowing anybody into the building here, but we are having people come up to the door, and we are providing them with food. And then we've mustered a group of volunteers who are actually going out into the community, delivering packages to people's doorsteps. But that's that's the key right now, is the food insecurity issues that, while we were at capacity before, have now really gone beyond their limits. And right now we're keeping up. My real concern is week, 2 weeks, 3 weeks down the road, when I expect the number of not only the food insecurity issues to continue to increase, but I think the other issues that have not yet hit us are going to hit us. So things like emergency assistance, case management services, helping people connect to community entitlements, finding out how to get unemployment compensation, how to hook up with Social Security, how to arrange for all of the benefits that they might become entitled to, is very, very difficult. And we have an elderly population as well. So just today, for example, we have an elderly population of Holocaust survivors in the Upper Fairfield County area who are unable to get out, who are unable to shop for food, and we have arranged for them to receive food. So right now, what we're dealing with mostly is food issues. We expect the other things to come up in the next few weeks. We have received a couple of requests now for our Hebrew Free Loan Program, which is, as some of you may know in the community, is a partnership with the Federation for Jewish Philanthropy and the Foundation, who is providing funding for Hebrew Free Loans that are going to be available to the community. So a lot of those things are things that I think we're going to see far more often in the next coming weeks.
Now, can you explain the Hebrew Free Loan for those who have, for whom this is complete new information? What is it? Who's it available to? What are the parameters?
Sure. So the Hebrew Free Loan Program will be an interest-free loan that will be available in increments of anywhere from as little as people need to a maximum of probably up to about $6,000. They will require your ability to repay those loans at some point. The terms will be flexible depending on what the ability of folks are to repay. So anywhere from probably 18 months to 3-year payback terms. A requirement will be that there is a co-signer who will sign on the loan with folks. We will take a look at your some of your finances and make determinations that you're eligible and in need of a loan, but the ability to repay it is going to be tantamount as well. But we're looking to try and help people out. We know that a lot of people are going to need those loans in the near future, so we're ready to help.
And I was pleased and proud that our Jewish Community Foundation for Upper Fairfield County last week agreed to make a pool of $60,000 available for loans for this fund. I can't think of a time that it's more needed, and we look forward to seeing it put to use to make impact to support the community. So thank you for giving us that opportunity.
Yeah, it's terrific. We're very grateful for that opportunity as well.
And just if somebody is calling your office, is the normal staff there, or folks working remotely, or people in the office?
So we have probably somewhere from 5 to 6 staff members in the office every day. There are certain programs that are, continuing to function. Our Home Companion program, which is the program that provides aids to primarily the elderly throughout really a good portion of certainly Lower Fairfield County. And I know Andrew has a similar program, but our folks are continuing to go out, and the families are requesting their services. So we have staff here that are fielding those phone calls, making sure that, aides have the appropriate information, know what they're supposed to do, and know where they're going. Our food pantry is operational. We are seeing people come in, all the time. So those folks are here. Some of our administrative staff is here to field phone calls, direct people in the right kinds of ways. But we're operating on a limited and alternating schedule, so that when we do our kosher home delivered meal programs on Thursdays, we have some staff and volunteer that are here that one day. And then we're trying to stagger people so that there aren't too many people in the building, because we want to make sure that we're protecting our staff as well, and trying to limit the number of people who actually are here and are in contact with other people, including staff and volunteers. So we are here, we're functioning on a regular basis, but with limited staffing.
So Andrew, I can imagine few things more complicated than overseeing a senior care facility right now. Tell us what you can about what's going on at Jewish Senior Services.
Absolutely. It's interesting because it's both the life that we provide on the campus for those who live here, as well as those that we serve out in the community, as Matt does and was describing. So the changes from what was sort of normal a month ago, we provide services and care for about 1,000 people a day. The vast majority of those continue to be served, most importantly, the people that live on the campus. And as well, most of the people that are cared for at home through home care, hospice, our Home Together program, Senior Choice at Home, all of the other things that we do to help people remain in their own homes. There have been a number of programs that have temporarily closed, including adult daycare, our J Fitness Center, our childcare program. And the people who are impacted, obviously, very directly by that are not only the clients, but the staff involved. So there's been some fairly significant changes on a broad scale. The complications get further when you implement the regulations, and the government is clearly trying to keep us appropriately socially apart. So we no longer have volunteers in the building. We no longer have any family members in the building, and the environment, which has been so vibrant and so active in the 3.5 years since it's opened on Park Avenue, has a very, very different feel. The staff, the doctors, nurses, aides, housekeeping, laundry, all the people that care for the loved ones that are there are still absolutely as they were, doing their work and doing a great job, and really been responsive to the changes in the environment. But make no mistake, it's very different, and we've tried to be communicative with family members and clients out in the community to make sure they know both what's happening and what's different. But since March 9th, which was the day that the visitation ban from the government came into effect, so 2.5 weeks ago, it is very, very different and clearly required us to adapt to a new environment. I think the main punchline, the main message I want to share is that services for all the people that we care for, both at home, home care, hospice, and certainly assisted living, skilled nursing, rehab. We continue to take admissions from the hospital. We continue to take new people moving in from the community that need to. As you know very well, David, and obviously Matt as well, when clients are in need. We need to be there for them, and we continue to both accept and care for everyone. We'll talk more about the illness impact in a little bit, but in terms of broad scope, the primary purpose of why we exist continues on with an incredibly dedicated staff.
And I imagine some things change on a daily basis. Is there like a mission control, a daily check-in? How do you manage this?
So thank you for acknowledging that. I mean, certainly we have more government agencies than I think I probably acknowledged before, but what comes through from the federal government, certainly from the Center for Disease Control and Prevention, as well as the Center for Medicare and Medicaid Services, which are the two big federal agencies, as well as then the state through the governor's office and through the Department of Public Health. Those are the four main regulatory oversight bodies, and we're getting at a minimum daily, sometimes hourly updates of what we can do and not do. It's impacted everything from visiting to care to equipment to staffing to backup plans to infection control to what do we do with staff when they're exposed to the illness. And yes, there's a very small group, including our medical and nursing leadership, that is trying to digest those each and every day, figuring out how and what we need to implement, and certainly staying on top of all of the scenarios that have played out as this has become more and more prevalent in the community.
Yeah, clearly Andrew has a lot more regulatory issues to deal with. One of the things that I did forget to mention is what we're also trying to do, David and Andrew, is that we're also trying to ensure continuity of cases via Zoom, so that we are conducting counseling sessions, on Zoom, and we have clients who are accessing this. And one of the things that we're going to be offering that we will send to you, David, in a day or two, is a number of new offerings that we're going to make available to people in the community who are, having some anxiety, having some concerns, dealing with issues, and trying to just have a forum where they can speak to counselors and therapists about their feelings and the things that are going on and strategies to cope with some of what's going on. But we're also trying to continue that remotely, and that seems to be working as well.
Great. And we're pleased to be creating some pages on our website that can be a clearinghouse for all of the things that are being offered in the community remotely, all of the ways that people can help. Andrew, I wanted to ask about, mask, gloves, gowns. Do you have the same challenges that we're hearing about everywhere else?
Unfortunately, yes. We, typically would run supply inventory of about a month, and in normal times, you just continuously get deliveries every week or twice a week, depending upon what product we're talking about. And clearly, the surge in demand has forced our suppliers to cut back on deliveries. We're still keeping up. We're still doing okay, but that has involved getting creative and reaching out to new suppliers. The government, from the federal government through the state request, did release some of the emergency supply that's kept hidden away for unfortunate incidences like this. And we did get a delivery this week from the Federal Reserve, which is awesome. We are still utilizing under our normal infection control protocols. One of the things we like to emphasize and continue to emphasize is we are very used to dealing with infection control. This is not a new subject. We deal with the flu every year. We deal with other respiratory infections over time. And the protocols in terms of staff treatment and the use of personal protective equipment is very well established. So our caregivers, our doctors and nurses and aides are really good at it, and having the equipment is what's critical for them to be successful, both for their own safety as well as the safety of the people that we care for. So equipment, looking ahead, is on or near the top of our list of anxiety, because you got to keep up. But for the moment, we've done well, and clearly people are being more and more creative, which is terrific.
Right. So Matt, there are folks in the community clearly now and in the coming weeks who never realized that they would be someone in need, who would need to look to an organization like Jewish Family Service. Yeah. Tell us both some of the new things you might be doing, but some of the things you've been doing all along that are there for resources for folks in the community who never thought that they would be the one calling Jewish Family Service.
Sure. You know, just this morning, actually, we got a phone call from an attorney who told us that despite the fact that, you know, he's relatively successful, he does have a great deal of expenses, and his firm is not paying out any payroll or any funds for the foreseeable future. And he was in a position where he had to call us to find out what resources we had available, you know, even for a guy like him and for his family. He ended up reaching out to us for some assistance with utility bills and also some food. So to answer your question, David, one of the programs that we offer is this thing we call case management. Case management is basically social service handholding. Is what we will do is we will help you understand what services are available. We'll try and get to the bottom of whatever the positions are, the things that have led you to the circumstances that you find yourself in, and then we will try and find all of the resources that are available to make you whole again. You know, a lot of the people who access our services start out like all the rest of us. They start out, you know, with homes and with jobs and with, you know, lives that are going along, and then something happens. And in this case, you know, we're looking at what portends to be, you know, devastating circumstances where people will lose jobs, will lose incomes, will, you know, people who are dependent on two incomes and now find themselves with one income. So they will come to us and ask for assistance with utility bills. They'll come to us and ask for assistance with food insecurity. Come and ask us, how do they access various things in the community, social security, disability, you know, food stamps for those people who may find themselves in that situation. But our job is to try and look at what you have, what resources you have, both your internal resources and the external resources that we can get our hands on, and try and put that all together to make people fully functioning and not need us. Our job oftentimes is to try and, you know, put ourselves out of business. We want to be here to help when folks need the help, but we want to see that people are independent and are self-sufficient and really don't need the kinds of backup services that we provide, such as small amounts of emergency assistance cash when somebody comes to us and needs, you know, medication or needs to have a car repair done. Both of our federations that support us, you know, provide us with some funding to ensure that that happens. You know, again, the food insecurity has become a major thing. People who are elderly, who can't get out, Holocaust survivors. So all of these services are things that we try and make sure that we provide those things that allow people to be independent and self-sufficient when they can.
Go ahead.
No, I said when they can be, yeah.
Right, and the starting point is just for someone to pick up the phone, call your office and say, I want to talk to a case manager.
That's all they have to do. Just reach out. You can send us an email, or you can actually reach out. info@ctjfs.org goes to a bunch of us here, and we all get those emails, and we will respond.
Right, Andrew, I assume that JSS is stressed to the max. Is there things that folks might not be aware are available from JSS for them, or is it it's enough right now to just keep your operations going as they're going?
I think it really is, to the extent humanly possible, business as usual. Mm-hmm. The majority of questions that have been coming through are, you know, mom is in the hospital or needs to be in the hospital. Will she be able to come there for rehab afterwards? And the answer is absolutely. We've continued to work very, very closely with the hospitals, not just for sort of normal discharges to us, either for inpatient rehab or for home care, but to make sure that we're coordinating the effort on a regional basis for what's going on, as there's an increase in demand for hospital services. So the regional healthcare system really does work very collaboratively. And as I think most everyone knows, we have a very strong partnership, certainly with both St. Vincent's Medical Center and Bridgeport Hospitals, which are two of the, you know, areas, I think, finest, both parts of larger healthcare systems now, both clearly sending referrals on a daily basis. So it's a good partnership, and people should know that the normal illnesses, you know, mom fell and broke her hip, still needs to be cared for, and we still need to take care of everybody that has those needs, either in the building or in their private residences. The big unknown as this evolves is the question that, again, we managed to have this conversation without getting too clinical about COVID-19 and the implications for individuals that are exposed.
Yeah.
But we've got to be very, very cognizant of the fact that there are large numbers of cases, certainly in Fairfield County. Those numbers are going to continue to grow as testing becomes more readily available. And we need to make sure that we're screening and protecting staff as well as our clients and residents who live in the building to make sure that we're not bringing that anywhere near others who are most susceptible, which, as you know, is the vulnerable elderly.
I assume if you're moving someone in now as well, you're moving them in without the assistance of their family, without the participation of their family.
Absolutely. This is a likely transfer by ambulance. The ambulance folks are screened. The individual comes in, they're immediately put in isolation to give us a chance to examine them, get used to understanding what their needs are, for the staff to get comfortable with the new individual, make sure we have all the medical records from the hospital or from wherever they came. And to the extent that, you know, the testing is still limited, we're going largely on symptom management. We hope a week or two from now, that's a different conversation. But for right now, it's based on where were you, who were you exposed to, how are you feeling, do you have a temperature? And unfortunately, it's a little bit of you know, dependence on the clinical collective healthcare system to make sure we're doing the right things to protect everybody. And as we said a minute ago, wearing proper protective equipment.
Right. So one of the things I love about this community, one of the many things I love about this community is we have so many people who are so generous with their time, with their spirit, people who are, you know, doing okay right now and know that there are other people who need help and want to figure out ways that they can make an impact. So what are ways that those who have a time and interest and are healthy enough to volunteer right now can make an impact, Matt, with Schoke JFS?
We have a couple of things that we have needs for. We're getting a lot of requests for, again, I harp on the same thing, but it's what people need is on the food insecurity. So we're actually looking for people to provide, you know, food and to provide, you know, food cards, grocery cards. So those are things that we would ask people to provide. But more than that, we also need people to deliver. And we have people who cannot get out and who are in need of food being delivered to their homes. We're making every effort to be very, very careful, you know, in terms of having any kind of volunteer contact. You know, unlike Andrew, that, you know, I know you said you couldn't have people, you know, come into the building. You know, we're dependent on these volunteers because we don't have the staffing to be able to reach out to all of the people that we're trying to reach out to. So what we've done is we are packing all of the groceries into predetermined bags. We're doing it obviously with gloves and with protective equipment. We are leaving these bags outside for volunteers with prearranged times. The volunteers then come and pick them up. They then take them to the places that they are to be delivered to. They leave them on the doorstep. We are in touch with the people receiving it. So one of the things we desperately are going to need, and, you know, with Passover coming up, we're very concerned about, every year we do a fairly large Passover delivery for people who, again, are unable to shop and take care of themselves. I know that we have, you know, 45 people in Upper Fairfield County that have depended on us year after year and are depending on us this year for Passover groceries. And we're hoping that we can find, like you said, David, we have a really nice core of folks in all of our communities that are really willing to do this, but we're going to need more. So if people feel comfortable getting out, they feel comfortable picking up, you know, food and delivering it, we could desperately use that.
Right, and I think we have information on our website at jewishphilanthropyct.org on the ways you could help page about how to volunteer to do food delivery and who to contact in your office. But if you want to mention who that person is,
Sure.
who does someone reach out to?
Sure. The easiest person to reach out, there are actually two people. I think the person we'll give you is Jill Knophoff, and she would be J, and then I'll spell it for you for anybody who wants to write it down, KNOPOFF at ctjfs.org. So that's Jill Knophoff. And certainly they can always call our number, you know, 4161, area code 203. The phones are answered and we will get that information. You can also go to info@ctjfs, and we all get those emails as well. But, we are looking for volunteers. We're looking for supplies, and, we are looking to try and minimize the people going into grocery stores and people, physical, contact with other people. But we are going to need Passover items. We're going to need food items, and we are accepting donations of food as well. So like you have seen, I'm sure, on the in the news, the food banks, not only ours, but everybody is suffering and really needs those donations. So we are open for those donations as well.
And Matt, I heard a good story today about something that our Federation staff was able to help facilitate and help with prepared meals for Passover.
Yep, yeah, that was terrific. One of the things as I mentioned before, is we have a kosher home delivered meal program, but we were unsure as to whether or not we could. And by the way, our kosher home delivered meal program is supplied by Jewish Senior Services, and they've been fabulous in making that work. We had a delivery today for our program tomorrow, and their drivers are here and they're timely, and it's just been fabulous. That partnership with Jewish Senior Services has worked out really well. Unfortunately, Jewish Senior Services is koshering their kitchen a little too late for some of our deliveries for the Passover program. And this morning I did get a contact from Stacy Camisar at Federation about a contact they had with El Al Airlines, who obviously is not flying, and Bornstein Caterers at JFK Airport is looking to, I guess, offload some of their, kosher Passover meals. So I was in contact with them today, and we've arranged for 150 meals from Bornstein Caterers that we will be picking up sometime next week. So that worked out really fabulously, and then we're going to deliver those and distribute them along with some of the other products that we're looking to deliver for Passover. And thank you to Stacy and to David for doing that. Awesome.
I'm delighted to hear that story. And are there products you're trying to source that you're having a challenge with that you'd like to let the community know about? Maybe someone knows a source?
Sure. Sure. Yeah. We are looking for somewhat large quantities. We have about 250 people that we hope to deliver to overall in our communities, and we're looking for matzah. We're looking for grape juice. We're looking for horseradish. We're looking for matzo ball soup mix, and a couple of other items. You can contact us, and ideally, we'd love to find somebody who could provide these in bulk. We've been in touch with a number of distributors with varying degrees of success and no concrete answers yet. The supermarkets that typically are very generous to us are, understandably besieged and not as willing and able to provide, the kinds of things they usually do. So we are looking for, those items, and you're looking for 250 pounds of matzah. So it's not, it's not your average one box in order to make sure this happens. And over the next week or two, we hope to be able to share it. If anybody knows of somebody that owns a store or is a wholesaler, by all means, please let us know.
Right. I think my mother of blessed memory used to buy 250 boxes of matzah for Passover, but unfortunately I don't have her to go to anymore.
Yeah, you're not following in her footsteps, huh, David?
No. So Andrew, if there are those who want to make a difference at Jewish Senior Services, even if it's helping residents feel a little less disconnected, are there ways that folks can make a difference?
Sure. Let me first just acknowledge the work that Matt and his team are doing, because it really is a time when people are reaching out in more and appropriately needing ways. And I think his agency just does a great job. We're honored to be able to be partnered with him, as he mentioned, with the kosher food program. And with any luck, we'll be able to source some food for Passover as well. In terms of us, the challenge is we're an organization that has an incredible history with about 300 active volunteers who engage with the residents in different ways, about 200 adults and about 100 students on a regular basis. And having those folks missing from the building is a challenge. Obviously, we can't replace that. We're not looking for volunteers per se at the moment. The 2 or 3 maybe helpful suggestions or thoughts that people would contemplate. One is clearly any kind of an item, whether it be a puzzle or board game or something that you think might be of interest to a resident or a small group, because we're not doing large groups of anything, but a small group activity that could be brought over and dropped off at the main community services entrance at the home, that would be awesome. The request has come from a few residents that don't have the capacity for either an iPad to use or any kind of smart device that we can connect them with their family members. We've bought a handful of those and they're working great, but iPads are clearly a device that residents would appreciate being used. And then, quite frankly, the biggest need for us is going to be pure dollars. We're premature to try and guess how much this adventure is going to end up costing in terms of both lost revenue and incremental expenses, but these are hundreds of thousands of dollars. It's not a small number, and we're trying to figure out how to gracefully ask for money, but certainly that's going to come up, and we will be certainly not bashful about being very grateful for any cash donations, because there's going to be a time when it's going to become more important, and I know for Matt in his organization as well, and obviously for Federation and the work that you're doing to support us all. So as people think about generosity when they've got the capacity, please know that it is absolutely needed.
Absolutely. So I want to open things up for questions from attendees, which you can do either by using the chat function or by raising your hand. And while we're waiting to see if we get any questions, I want to ask you both how you're managing staff morale, because your staff have all of this that they're holding. They also have what they're holding at home. So how are you managing staff morale, and are there things we can do as a community for your staff to let them know that we're grateful for what they're doing?
So a couple of quick thoughts, and I appreciate the question, because there's no doubt we can't do what we do, and I know Matt the same, without an incredibly dedicated group of caregivers. I'm walking around a lot and trying to say thank you. We're posting messages on Facebook. We're writing letters to our entire Jewish Senior Services community, recognizing and thanking their efforts, especially in these times. I think people in the community can post on Facebook and send messages through whatever social media to say thank you and acknowledge the work that they're doing. You know, these are folks that come to work every day and then go back and have whatever personal issues and challenges to address in their other lives, but we're very grateful. And you know, having give or take 900 people that are making our work possible is an enormous responsibility. And I always say my biggest job in the role that I have is to thank them and be a cheerleader for the folks that are on the front line doing really incredible work. And I hope that they know how much it's appreciated. We sent another message today of thanks, and certainly anybody in the community that wants to echo and help support that, it's appreciated and it's very sincere.
Yeah, I would echo Andrew's comments as well. My biggest problem is trying to keep my staff from coming in. They're like Andrew's staff, I'm sure they're very dedicated, and they feel terrible that they can't be here to do the work that they feel a responsibility to do. So they're you know, a group of truly committed, dedicated staff who would really like to be here with clients, and it's frustrating to them, and I think painful, that they know the people that they serve are people in need and they can't do it. And I think that's very frustrating to them. So, you know, we have tried to maintain contact with our staff. They're in contact with us, you know, frequently by email and by phone. We had a staff meeting yesterday with all of our staff on Zoom to try and keep them connected. And, you know, we are, like Andrew started out, you know, right now we're maintaining the status quo, but, you know, we look around at sister agencies and at other organizations who are, you know, doing mass layoffs and, you know, terminating staff because they can't afford to keep them up. Right now, we haven't had to do that, but obviously going forward at some point, you know, there are concerns about how we're going to be able to continue managing with lost revenue and with decreased donations as folks are struggling. But we would love to have people reach out to our staff as well, and you know, send us you know, anybody who's we have a lot of grateful clients who have received a lot of you know, really positive. We have a very, very strong, dedicated, like all of us, but dedicated working staff who and clients are just so grateful, particularly in this climate, for the little miracles that some of our staff are able to pull off. So I think they get a lot of satisfaction out of it, and we try and let them know that.
So we do have a questioner who I am going to bring in. I think that this is my friend, our colleague, Michael Bloom from JFAC, the Jewish Federations Association of Connecticut. Michael, is that you?
That is me. Can you see me and hear me?
We can hear you. We can't see you.
Okay, that's fine. I just wanted to offer JFAC services. Andrew, I know you are connected with GBA, and you're still unwinding everything that's coming out of the stimulus bill from the feds and what may come down today, but the state is offering to potentially do something as well. So if you have suggestions on ways the state can help, I'm happy to help advocate for those policies.
Thank you. There are many open discussions, because clearly we are too big an organization to benefit from anything that they talked about for the small business associations. So while healthcare is very much identified in the stimulus bill, it's largely targeted to hospitals, and our association through Leading Age has obviously been active up there, but I will get you some updates about what we are particularly asking for in order to help. And thank you for the suggestion and offer.
And
My
Michael,
pleasure.
for those who are listening who might be involved with other local nonprofits, including congregations, can you just talk for a minute about the SBA loan program that's coming out?
Yeah, so there's some new news coming on it that I was just checking that out, of a loan of up to $75,000, this disaster relief fund. It's a very, very low % interest to basically bridge you to another loan. But there's plenty of information available. Unfortunately, it looks like the SBA website is crashing because people are obviously going on it. But the state does have a very good website under the governor's, which you can get on the governor's webpage under ct.gov. But any organization can apply for these disaster loans and other SBA loans.
Great. Michael?
And they're taking applications. Sorry, the story just came out. The Department of Economic Community Development is starting to take applications on this short-term bridge loan tomorrow.
Great. Michael, thanks so much. For those who don't know of him and his organization, Michael is the lead professional for the Jewish Federations Association of Connecticut, who are our advocates in Hartford and to some extent in Washington as well, advocating on behalf of our federations and our local Jewish nonprofits. Michael does a great job doing that. So Michael, I'm grateful that you joined us in this conversation.
My pleasure. Thank you for everything you three are doing.
Thank you. Any other questions? I have just a comment. Just wanted to say thank you for all your great work from Frida Hecht. I have a suggestion for Matt, and a very specific suggestion. Have you contacted Fairway or Seasons in Scarsdale about purchasing the kosher items that you need in bulk at a discount?
We have contacted Fairway, as you may or may not know, that yesterday or today was their deadline for a buyer. And if they didn't have a buyer, they were supposed to shut down. I don't think they've actually shut down, but they are telling us that they cannot be helpful to us. We have been in touch with both ShopRite and Stop and Shop. Both of them have, we're waiting to get back. I will make one comment and one mention of the Food Town in New York State. There's an owner of 11 or 12 food towns. His name is Dan Katz, who has been very, very generous to us with supplying kosher items for our food bank. And unfortunately, he's overwhelmed as well. But we do have a request into him to look for some of those items. And we've reached out to, not reached out to Seasons. We have, however, reached out to all of the other local grocers, and we're waiting to hear back from some of them.
Great. Would welcome any other questions if we have them, but I think the question that I would ask, and it's probably a complicated one, but how far out are you planning on the horizon for this? Is this a day-to-day thing, or are you saying, you know what, we need to be planning or 3 or 4 or 6 months from now?
Well, that is the probably most loaded question you've put on the table so far. And obviously, none of us know the answer. The way I'm describing it, at least internally in the organization, is that this is not a short-term conversation. This is a longer-term conversation. How many weeks, how many months is a impossible question to answer, but I think we're planning for it being a while. And the large issue really is what happens in these next few weeks in terms of spread of the disease and how many people are not only positive, but hospitalized. So it's a two-edged sword. We expect there to be thousands more cases. Again, your guess is as good as mine, but it's really an impact of how much of a healthcare system impact it has in terms of hospitalizations. And then over time, people will build immunities. There will be more treatments. There certainly will be a vaccine somewhere into the future. But I think for the immediate sense, we're kind of going day by day, week by week, with the expectation that it's going to be a while before we really see things start to come back to normal.
Well, I'm a social worker, so I'm an optimist, but we are also taking this, I can't say day by day, but week by week, and I'm looking at a 4 to 6 week turnaround, but don't any of you hold me to it because I'm sure it's probably not true. But as my optimistic viewpoint, we are continuing to operate because in our view, there's certain things we just can't stop doing. We can't stop with food insecurity issues. We can't stop with our home companion programs. So those things are going to continue indefinitely. And we are taking it at this point on a week by week basis, and we are hoping that, as many of you have experienced, this has thrown a monkey wrench into lots and lots of our different plans. We had a gala plan for April 26th that has been canceled, as everybody's has been shifted and canceled. All of these activities that we had planned, conferences and gatherings, so they've all been canceled in the foreseeable future. But we're planning to try and continue this and hope that we'll see some turnaround by summertime.
David, let me add one more quick comment, which is about the whole subject of social distancing that we've alluded to, eliminating big groups and all the work we're doing like this program today. That's going to be the driver. And to the extent that people are taking it seriously and paying attention, it makes an enormous difference because the disease is clearly being spread person to person. So I'm going to make my standard plea, which I know Matt will echo and you will echo. We have to do a better job as a community in being respectful of what we're being asked to do. And unfortunately, we've all heard and seen examples that are contradictory. We've got to keep our distance. We've got to wash our hands. We've got to follow these protocols that are incredibly simple to say, a little harder to implement perhaps, but the more that we're good about it, the less impactful the disease is going to be, and the more likely we're going to be able to manage the implications for our healthcare system. So pay attention, and I can only beg people to follow the rules.
Absolutely. So I want to end on a really positive question. One of the things that I've been most grateful for during this crisis is to be part of the community that we're all in together. The way that individuals have stepped forward, the way that our clergy are working together, the way organizations work together. And I just want to give each of you an opportunity to comment on that as well before we wrap up.
Go ahead, Matt.
Well, I guess as I mentioned before, one of the things that I think has come out of this, David, is just echoing what you're saying, is we're just seeing an enormous amount of people wanting to help, wanting to be involved, really reaching out to us, reaching out to others, people genuinely caring about, each other. And it really is hard to be in a community like ours and see the amount of caring and the amount of, consideration that people have for another. In fact, that they're willing to, come out of their homes, even in times like this where people, I think we're living in an era where you're walking on the street and you're actually afraid of the neighbor that's passing you on the other side of the street, which is just unheard of. It's unprecedented. And I think that the fact that we have this community that is pulled together and is connecting in ways that we never imagined they would connect before is just so heartening. And I'm so grateful to be part of it. I think that's what's come out of it for me.
I'm only going to add to that with a very brief echo, because the reality is we are privileged to be part of a community that's very special. I moved to Fairfield County 31 years ago, having spent my youth and my young adult life in New York City. The people here really do care and make an effort and engage, and we're blessed to have strong federations, and we're blessed to have great organizations and social services that people are paying attention and care, and the longevity in the leadership is testament to people wanting to be here. And certainly grateful to Matt and his team, and to David and your team and the work that you do. We're very proud of being part of this community. So thank you.
Great. I want to express my gratitude to both of you as professionals, as friends, as colleagues. It feels comforting going into a situation like this, knowing that that our Jewish social service agencies have leaders like the two of you at the helm, both working for your organizations and working together and working with us as a community. So thank you for carving out this time today. Thank you for all you're doing to help lead our community through this crisis, for taking care of all of those that you've already been taking care of and those that you'll newly be taking care of as well, and for opening up the doors to allow us to help you as well. And I'm getting a lot of comments that are coming in the chat now. They're saying, thank your panelists for their insight into their organization's work during this difficult time. Thank you all. And so I know it's not just me, but it's a community who wants to give thank you as well. So thank you for your time today. And we're here for you and your organizations to support you in all of the important work you're doing. Thanks.
Our pleasure.
And take
our
care of
pleasure.
yourselves.
You too, David. Thank you.
All right. Bye-bye.
Bye.